UTIs or urinary tract infections are very common in women. You might also hear them referred to as cystitis. And they're more common in women than men because we have a much shorter urethra or water pipe, and our urethra is much closer to our bottom. So the main cause of urinary tract infections is a bacteria called E. coli, and it can cause a number of different symptoms depending on whereabouts in your urinary tract it occurs. So you can get problems like pain on passing urine, having to go to pass urine more frequently, or in more serious infections it can travel further up to the kidneys and cause a more severe infection. And so if you do have a fever, or you have blood in your urine, or you're feeling generally unwell, you should definitely go and see your doctor and have that looked at, because you may need to have some stronger antibiotics. We also know that the urinary tract and the vagina have bacteria in them naturally. And when the balance changes and this E. coli becomes more dominant, then that can give you symptoms of a urinary tract infection. And the thing about E. coli and why it's such a successful bacterium in terms of causing urinary tract infections is because it can grab hold of the lining of the urinary tract. And so although we can give antibiotics, which are helpful for many of the symptoms, you can get recurrent urinary tract infections that keep coming back, because literally the E. coli is hanging on in there in your urinary tract. And so we need to look at alternatives for treating that and flushing out the E. coli. And we know that supplements like cranberry and also D-mannose are very helpful for flushing out the bacteria from your urinary tract.